is external rotation on a cable, anything like that. Get to a certain point, shoulder just feels like it pops, and I get pain. I can't obviously move sort of that way then.
Okay. Very good.
This side's fine.
Okay. No pain.
When I get to that, I feel pain.
Okay. Okay, good.
Weird out,
So I already know that Seb's got pain on the front of the shoulder, so I'm just going to passively assess the shoulder and just have a little palpation around the deltoids, the upper trapezius, the rotator cuff muscles before I actually go into my treatments. So when it comes to treatments for shoulder pain, and especially pain with any kind of rotation, external or internal rotation, obviously the main muscles that will be responsible for that will be the rotator cuff muscles. Before I go into explaining more about them, I just want to talk about where shoulder pain usually comes from. And this is based on kind of what I found over the years. And most of the time when we're talking about kind of anterior shoulder pain or kind of pain on the front of the shoulder, acromion pain, coracoid process pain, or like bicep tendon pain, most of the time there is some kind of connection with the rotator cuff muscles, or to be more specific, the infraspinalis, which is the muscle which I'm treating at the moment. So if you want to locate the infraspinalis, all you need to do, you need to kind of trace the triangular shape of the scapula on the back of the shoulder, and then once you've done that, you need to kind of palpate the center of that triangle and then press some of the points, which can be very painful, on the back of the shoulder blade. Once you do that, the patient may experience traveling pain to the front of the shoulder. Like most of you know, we don't like to kind of put words in people's mouths, but if you just ask people like, where can you feel this somewhere else rather than where I'm pressing, and they usually say like, yeah, it kind of feels like it's going through to the front of my shoulder, which straight away tells you, yeah, there's some kind of a connection there with the actual pain that they feel with the movements that they're producing. So obviously I'm going to spend quite a good time working on the infraspinalis, and as you can see at the moment, I'm working on creating some contractions in that muscle by doing METs, and then followed by some joint mobilizations. So when it comes to soft tissue treatment, I use quite a lot of different modalities, starting from myofascial release, trigger points, even soft tissue release, just trying to lengthen that muscle and trying to kind of release the trigger points which will be stuck in the tissue. When it comes to kind of releasing these points, what you need to kind of also keep in mind is that, muscles are not 2D, they're 3D. So you want to kind of target the trigger points from all different directions, not just directly pressing onto the muscle, but also looking at changing the angle of your thumb, kind of going around. So yeah, that will be very beneficial for your treatments because you'll be able to get more out of the soft tissue. Once I finish the infraspinalis muscle, I will move on to the subscap, which again can be pretty painful, and I would say that most people really dislike having this done. However, it's very, very important because it's one of the muscles that are pretty hidden in the body, and it's very difficult for people to kind of realize that there's something going on with that muscle until you point it out to them. So I'm going to work with kind of mobilizing that muscle along with mobilizing the glenohumeral joint until I feel that there's some kind of a release, and most of the time you can. And as Seb showed there, he feels a bit of a traveling pain into the elbow. Okay, how's that feeling now?
Yeah, not bad.
Yeah, any pain?
No restriction, I can feel it restricting.
Good.
It's more restriction this side now.
Okay.